afternoon, honorable judges and the audience. I am very thankful to IPDI for this opportunity to present here. I am going to present on a case of syncope in elderly. Mrs. Powdell, 82-year non-smoker, presented with 3 episodes of syncope in 2 months. The first 2 episodes occurred while she was sitting, and the third episode occurred when she was walking. The last episode associated with fall, and she sustained some injury. However, the family member doesn't give history suggestive of seizure. There was no history of hypertension and diabetes, and on physical examination, her vitals was within normal limit. There was no postural drop of BP, and other systemic examination, including neurological examination, were normal. This is the ECG of same patient showing left bundle branch block with the QRS duration of 3 small box. Other blood investigation, including electrolytes, were normal. Her echocardiography showed mild MR and ejection fraction of 50%. Her Holter monitoring was normal, and coronary angiography was normal. As the patient is elderly lady with left bundle branch block on ECG, we performed coronary angiography, which was normal, and a neurologist evaluation also showed normal. There was no other causes of syncope was found. She was managed with single chamber pacemaker, and on follow-up after 3 months, she was symptom-free and doing well. This is the ECG after pacemaker insertion, which the ECG without magnet showed her previous, similar with the previous ECG, and with magnet showed at the rate of 100 beats per minute. And this is the chest X-ray showing generator and the leads. On discussion, in a patient in bundle branch block, there is increased risk of AV block in patient with history of syncope and prolonged his ventricular interval if the his ventricular interval is more than 70 milliseconds. There is one trial called spectral trial, which divided around 150 patients into 2 groups. One is the empirical pacemaker insertion, and the other group was implantable loop recorder. Those patients who were on loop recorder, there were increased cases of bundle branch block, increased cases of AV block. Patients with left bundle branch block or bifascicular block has higher rate of positive electrophysiological studies. These positive electrophysiological studies meaning the baseline his ventricular interval of more than 70 milliseconds, or if the pharmacological stressing was done, the his ventricular interval of more than 100 milliseconds is considered as positive electrophysiological studies, or if there is incremental atrial pacing was done, the induction of second or third degree AV block was considered as electrophysiological positivity. And this is the 2021 ESC guideline. Had it been the patient with ejection fraction of less than 35%, we could have gone for ICD or CRTD placement. However, our patient is 82-year frail lady with ejection fraction of around 50%, so we empirically implanted with pacemaker. And the ESC guideline, they recommended it as a 2B indication. On take-home measures, as this case is not that straightforward case and difficult to challenge, as the patient was 82-year frail lady who has 3 episodes of syncope, and the last episode resulting in fall, and she sustained some injury. So a elderly patient with a left bundle branch block, we performed the pacemaker implantation. So it can be done on the clinician's judgment basis. Thank you.